In 1927, the Nobel Prize in Medicine was awarded to a doctor who deliberately infected hundreds of psychiatric patients with malaria, ran mosquito farms inside asylum wards, and passed parasites from patient to patient using nothing but a syringe and someone else's blood. This is malariatherapy. Welcome back to the lab, my curious test subjects. Today we are diving into the story of Julius Wagner-Jauregg, a Viennese psychiatrist who looked at patients suffering from syphilis-induced madness and thought, you know what might help? Malaria. Intentional malaria. And the truly wild part, it actually worked. Well, sort of. Enough that he won a Nobel Prize for it. This is the story of how one man turned psychiatric hospitals into parasite breeding grounds, how a single soldier's infected blood launched a global medical movement, and how the line between bold innovation and deeply unethical human experimentation became so blurred that nobody seemed to notice the difference. So strap in. We are about to explore fever therapy, mosquito colonization, and the Nobel Committee's most questionable decision. Let's set the scene. Early 1900s, Vienna. Neurosyphilis is everywhere. Think of neurosyphilis like a late-stage untreated STI that attacks the brain. Dementia, paralysis, psychosis, all irreversible. There is no cure. There is no treatment. Patients deteriorate in asylums until they die. It is grim. Enter Julius Wagner-Jauregg, a neuropsychiatrist who notices something strange. Patients with neurosyphilis who happen to get sick with something else. A fever, an infection sometimes got better. Not cured, but better. Less psychotic, more functional. Temporarily lucid, Wagner-Jauregg starts thinking, what if fever itself is therapeutic? So he begins experimenting. First, he tries typhus vaccines, induces fevers. Some patients improve. Then he tries tuberculin injections. More fevers, better results. He notices a pattern. The patients who respond best are the ones who have the most severe reactions to the tuberculin, and the ones who are already ill with neurosyphilis. Side effects were considered a feature, not a bug. But here is the problem. The improvement does not last. Symptoms return. The fever helps, but it is not enough. And Wagner-Jauregg realizes something critical. The patients who improved the most were not the ones who just had fever. They were the ones who had actual infections, real disease, not artificial heat from a vaccine or injection. Real living pathogens doing real damage and somehow in the process damaging the syphilis too. So what do you do when fever helps but fake fever is not good enough? In early 20th century medical ethics terms, that means you go looking for a disease you can control, a disease with predictable high fevers, a disease you can start and stop. And in 1917, Wagner-Jauregg found one. And where exactly do you get malaria in Austria in 1917? Malaria does not naturally exist in Austria. It is like trying to run a tropical disease clinic in the Alps. But Wagner-Jauregg gets lucky. An Austrian soldier returns from the Balkans, infected with benign tertian malaria caused by Plasmodium vivax. Mild malaria, controllable malaria, treatable malaria. Wagner-Jauregg takes blood from this soldier. Consent was not part of the protocol, and injects it directly into 9 patients suffering from neurosyphilis. Some he injects under the skin, some he rubs into open wounds. The goal? Infection. The patients develop high fevers, 5 to 6 hours of burning heat. Every 48 hours like clockwork. The malaria cycles, through them in waves. They go through this for weeks. Fever. Break. Fever. Then, once Wagner-Jauregg decides they have had enough, he treats the malaria with quinine and the syphilis with neosalvarsan. And here is the wild part. It works. 6 of the first 9 patients show real improvement. 3 of them recover completely. They go home. They return to work. They are functional human beings again, in early 20th century medical ethics terms. That means he just proved you could treat one deadly disease by deliberately infecting patients with another deadly disease and then treating both. Let's track the results. Patients 1 through 3 recovered completely. Sent home. Patients 4 through 6, significant improvement. Still symptomatic but better. Patients 7 through 9, minimal response. Still psychotic, but 6 out of 9? That is a success rate no other treatment for neurosyphilis could touch. And so, malariatherapy was born. Now came the next problem. How do you scale this? So how do you keep a malaria treatment program running in a country with no malaria? You need a constant supply of the parasite. You need fresh infected blood. And Wagner-Jauregg comes up with a solution that is as efficient as it is disturbing. He takes blood from a syphilitic patient who has been infected with malaria and injects it into another syphilitic patient who needs malaria, patient to patient. Direct transmission, human parasite reservoir, in early 20th century medical ethics terms. That means psychiatric patients became a living blood bank for parasites. No soldier needed. No external source. Just pass the malaria down the line and keep the treatment going indefinitely. But that is not all. Malariatherapy spreads fast. Hospitals across Europe and the United States adopt it as the standard treatment for neurosyphilis. And since most of these hospitals are not located in malaria-endemic regions, they need their own supply. So they establish colonies, Anopheline mosquito colonies, inside psychiatric institutions. Imagine if modern hospitals kept mosquito farms in the basement to infect patients as therapy. That is what this was. Yes, they literally bred disease-carrying insects in mental institutions on purpose. Doctors would let the mosquitoes feed on malaria-infected patients, then let those same mosquitoes bite the next round of patients who needed treatment. Controlled, efficient, completely insane by modern standards. And in 1927, Julius Wagner-Jauregg wins the Nobel Prize in Physiology or Medicine for this work. The Nobel Committee praises his innovative use of malaria to treat neurosyphilis. Malariatherapy remains in use for decades. It is not abandoned until the 1940s, when penicillin finally arrives and actually cures syphilis without needing a second infection. But for 30 years, this was state-of-the-art psychiatry. And that is how a Viennese psychiatrist won the Nobel Prize for turning mental patients into malaria incubators, breeding mosquitoes in hospital basements, and calling it therapeutic progress. In early 20th century medical ethics terms, that means he got an award. Let's recap. My curious test subjects. 1 soldier's infected blood. 9 experimental patients. A treatment that required you to give someone malaria on purpose, let them suffer through weeks of cyclical fevers, then treat both diseases and hope they survived. A global medical system that ran mosquito farms inside psychiatric wards and passed parasites from patient to patient like a macabre game of telephone. And a Nobel Prize for the man who made it all happen. Was it effective? For some, yes. Was it ethical? Absolutely not. Did it save lives that otherwise would have been lost to neurosyphilis? Probably. Did it also use some of the most vulnerable people in society as experimental subjects without consent, turning them into living disease vectors? Definitely. Science is complicated. History is messy. And sometimes the line between genius and mad scientist is just a syringe full of malaria. If this experiment fascinated you, my curious test subjects, leave a comment below and subscribe for more stories from the darkest corners of medical history.